Welcome. We're back for another important conversation with Kim and Donna, who each live with IgG4 related disease and bring their personal experiences of navigating this rare condition. In this discussion, they'll open up about emotional and psychological challenges that come with misdiagnosis, uncertainty, and feeling unheard. We're also joined by Dr. Al Friedman, a psychologist with a personal connection to rare disease and a deep commitment to supporting patients. Together, this group will explore how living with unanswered questions affects mental well-being, the role of support networks, and what healthcare providers can do to better acknowledge the emotional aspects of rare conditions. Thank you so much for sharing your story with us today. We know it's not always easy to talk about your health journey, especially the challenges and emotional moments along the way. Your honesty and openness are what make this project so powerful. Going through a period of time when you're trying to find a diagnosis, you're seeking answers, maybe you're getting some miscues, maybe a misdiagnosis, as you both experienced, and you thought one thing was going to happen, you let that resonate and deal with that, and then it's like a shift. You had to pivot and deal with another diagnosis on top of that, and it's like starting all over again. What does that do to your emotional health? Can you each explain what emotional toll that took on you, and how did you cope with that?
Oh man, Shelley, that is a loaded question, but it's a great one. As you mentioned, when you're first misdiagnosed, in my situation, I was 35 and given a misdiagnosis of ovarian cancer. I had just bought a house. I had just gotten married. It was a huge slap in the face emotionally. I think I went through all the stages of grief within a 1-month period, and it was very challenging to not get ahead of myself in looking down the road at what this could potentially be, since we weren't sure exactly what was going on initially. So any sort of emotion, anger, sadness, frustration, denial, bargaining. I went through it all while we were figuring out exactly what was going on. Then I seem to have come to terms with this initial misdiagnosis of cancer. And then, as Shelley said, when you pivot and get your actual diagnosis, I went through all of those same emotions all over again. You thought you had it figured out with how you were feeling and resolved in your own brain about having a cancer diagnosis. And then it's, oops, nope, just kidding. It's actually this lifelong rare chronic illness. So it was definitely very challenging, just the whole process of going through the misdiagnosis and then the actual diagnosis. So it definitely took some time to swallow it, but the initial response was a lot of like fear, worry, and being scared for the unknown.
I imagine so. I really cannot even imagine what you went through to get such a life-altering diagnosis and then try to deal with it the best that you can and then have to go through it all over again. And Donna, you had a similar experience. Can you
Yeah.
share about that as well?
Yeah, very similar to what Kim experienced, and so many of us are misdiagnosed with cancer when we are actually have IgG4 related disease. And I just remember, the cancer that they thought I had, the urologist, when I asked him, what if this is malignant? He had said to me, well, it's not a good cancer to have. And, I know what that means. And, once I had actually seen it in paper when I was discharged from the hospital after they had removed my kidney, and the diagnosis was urothelial cancer. And I lost it. It was the first time, my daughter the following year was going to be graduating from high school, and I wasn't going to be around for it. I mean, I was going to die from this. And so it was just this overwhelming period of time that was thankfully a very short period of time, relatively speaking, but the longest 2 weeks of my life, waiting for pathology to come back and see those words, no malignancy detected. And so, all of the trauma that you go through with all of that stuff, and just like Kim said, all of those, the anger, the sadness, the distraught, the bargaining, all of that stuff, like I was going to lose, and I kept thinking, not only of myself, but more for my daughter and what what she was going to have to go through at a young age. And then, thankfully and thank God, to find out that it's not cancer. And then you're like, okay, no, what does this mean? So what is this? And you're starting this process all over again. And it's for a disease that really not much is known about, but it is still, even with as much as we know, there is still so much that we don't know. And I guess the trauma still follows you. Like my nephrologist, will joke with, I'm hyper vigilant about my remaining kidney. I'm very paranoid about my kidney function because I didn't see this coming. I don't want to have a kidney transplant. So I'm always like, are you sure my kidney's okay? We do testing constantly, and she's always answering great questions for me. But that trauma, I don't think is ever going to go away. I think that's, kind of like the PTSD that I carry with me for what this disease has silently done to me. So I'm not sure that will go away, but I do have great support system still. And, the friendships that I've made, especially within the community, are really just instrumental to that.
It's important, I think, that you acknowledge too that, you don't know if that the hypervigilance, as you put it, will go away. It's important to be aware of changes in your body and to speak up when something's not right. And this isn't something that gets treated like a sore throat or a strep throat or something, and then you take an antibiotic and then it's gone. You're living with this and you're treating it and you're dealing with it, and it's complicated, isn't it?
Absolutely.
Were there moments or particular moments that stand out in your mind when you felt like you were not being heard and you were not being supported by any entity, whether that's your healthcare team or your support system?
Yeah, I think that you never stop advocating for yourself, right? You never stop advocating for what I feel and what my symptoms are and how it relates or doesn't relate to my disease. And so it can be frustrating to feel like you're just, always in this place where, am I trying to convince, my doctor that the symptoms that I'm feeling or what I'm having are related to this? It can be frustrating. I mean, and I understand, and I see both sides of it because I work in the medical field. And so I understand that there has to be some thought that, like, okay, let's think, what else could it be before we assume everything is this? But then that's difficult because when my entire world basically medically revolves around this condition, it's hard to think that any symptom that I have would be something else, especially if it's in the area of my body that I, typically experience symptoms, or it's typically on a spectrum of like an autoimmune kind of flare up that I'm having. So, I wish it was easier to navigate this disease. And I wish that it was more black and white with what we feel and what our symptoms are. And, but it isn't. And that's just the nature of the beast. And it's by communicating like this as patients with our physicians and all of us doing that this information will get out, and that they'll start to realize that maybe there are different spectrums of this disease, symptom wise, that they haven't discovered yet, or more people have this than not. And I think that's one of the things that we've really discovered by talking with each other, is that, I was like, I realize I have different symptoms, and I have more symptoms than I thought I did just by speaking with other people who have the same condition. So we're never going to stop advocating for what's going on.
The particularly challenging moment for me that made me feel unsupported was just right after diagnosis. I was given this diagnosis of a disease I had never heard of before. And like Donna, I'm a nurse. So it was very surprising that my doctor was telling me, oh, you've been diagnosed with IgG4 related disease. And I was like, huh? Like, what is this? And so when you're diagnosed with a rare disease, that's kind of it. Like, they tell you have this diagnosis and this is what we're going to do for treatment. But then what? Like, you're telling me this is a lifelong chronic illness. How do I go about navigating this? How do I, like, the physical and the mental side of it? I remember walking out of my appointment feeling like, what do I do now? Where do I go now? And so definitely like at diagnosis, I felt the most unsupported just in not knowing what was coming next and not knowing like what was treatment going to look like? What was the prognosis of this going to look like? And fortunately, at the time of my diagnosis, there really wasn't a whole lot of information out there about IgG4 related disease. Even the research journals that you could find were outdated and spoke solely of the demographic of elderly males that typically present with this disease. And I don't fit that category. So just the lack of information that was available and that I was even given from my doctor was really challenging at first. But being able to do my own research, connect with people online, and then ultimately like meeting people like Donna in person and sharing personal experiences of, oh, you have retroperitoneal fibrosis like I do too. Oh, it doesn't affect your aorta. It doesn't affect mine either. I mean, just getting to share different experiences with people who have your same disease was really what allowed me to kind of cope with this, all of the unknowns of it initially.
So it sounds like what you're saying, Kim, is that, and what Donna, you said as well, is that when you walked out of the doctor's office after getting your correct diagnosis, I should say, you weren't given like a packet. You know, like when you buy a washing machine and they give you like this big packet, a manual that goes with it, and then you get like a QR code to stay in touch, and you know, you get a warranty and all this stuff. You got nothing, right? You just got the words. You have IgG4 related disease.
Yeah. And what was really interesting is prior to that, when I had been misdiagnosed with ovarian cancer, before I left that appointment where they told me, we're pretty sure that you have this, but we want to do another biopsy to confirm. Before I left the room, I was put in contact with a social worker and a case manager and all of this stuff when the words cancer were in the picture. But you remove that and it was just rare disease or chronic illness, and none of those resources are provided. That was something I noticed a big difference in, unfortunately.
Donna and Kim, thank you so much for sharing about what you went through. I mean, this is, the trauma, the level of trauma is really unbelievable, and the support that you might have received had you had the actual cancer diagnosis versus the support that it was just like, you know, vacuumed from you. Like you just didn't have it anymore and you were starting over. Just, you know, find out everything that you could about this condition you knew nothing about. And you're both nurses, so you're very knowledgeable about health conditions, but it's still new because there's not a lot of research. And so then I'm going to turn this over to you, Dr. Friedman. How can the uncertainty, misdiagnosis, and not being believed by providers affect a patient's mental health? And what coping strategies do you recommend?
It doesn't help anybody when any of us as human beings have a concern, and it's a real concern and an important concern, and it's not taken seriously, or it's misunderstood, or we don't feel listened to. That brings people down. It doesn't lift people up. So all of that can affect a patient's mental health on top of the uncertainty that patients already feel because of the symptoms themselves. The IgG4 population, as I've worked with people in this community, have experienced a great deal of uncertainty, a lot of misdiagnosis, and long diagnostic journeys. And I have great respect for what people in this community have endured. The coping strategies, again, are stick with the people who care about you, stick with the people who lift you up and don't bring you down, stick with the physicians who are willing to take an interest in you and find that needle in the haystack. And then most importantly, you find each other, just as you have here on this session, in this conversation. I consider the SMA community, the condition my son had 30 years now, it's my extended family. It's like a whole second family. Even 4 years after my son's passing, these are my family. And once you find your people, you understand each other, you lift each other up, you share knowledge, you share tips, you share strategy, you share doctors, you share resources, and you stick together. There is great strength in numbers. And I think it's really important for people to connect with each other. I do a lot of work as a therapist and one-on-one counseling sessions. But I think the most powerful help I see for rare disease patients is when I'm facilitating a group of patients and the patients help each other. And there's so much more that can happen when there's a group of people who have this in common. And I just feel so privileged to be part of those conversations with a group of people who are lifting each other up.
You've mentioned the importance or the benefits that patients can have in talking with each other and supporting each other, and how family can support. Is there anything in particular that communities like patient advocacy organizations or other patient communities could do to help people manage the emotional toll of living with a rare condition?
The attention to the emotional toll and mental health toll of a rare medical condition always lags behind to the attention to the physical care. And that makes perfect sense. I can tell you, even though I'm a psychologist, it's my job. For 26 years, when I was taking care of my son, who required a lot of care, I didn't have time to talk about how I felt about it. I was busy keeping him alive. So there's a practical reality of taking care of our bodies first. And oftentimes the attention to mental health does lag behind, but it's just as important, which is why I'm so grateful to be included in the conversation today. And I think, to answer your question, many of the advocacy groups I work with, and I work with a couple dozen actively at this point, are putting more time and resources into paying attention to the experience of having a rare disease at an emotional level, at a mental health level, at a family level. I think the pandemic kind of shined a light on mental health for the whole world and destigmatized it a bit. And I think there's more attention placed on mental health in general now, and the rare disease communities are catching up while still paying attention and needing to pay attention to the physical care of the patient, the medical needs of the patient, and treatment options for patients. When communities offer programs like this, when they offer support groups that are held on a regular basis for patients to gather together, when they host conferences, when there are peer support programs, ambassadors, where there's one-to-one peer support with training for the volunteers. I'm involved in some of that. There are many, many different ways for advocacy groups to support the mental and emotional health needs of the patients. It's more challenging with ultra rare because there's very few patients. So the challenge for some of the groups like IgG4 is that it's a small number of people. So to garner those resources takes some effort. Technology, just as we're on a Zoom kind of technology today, helps bring people together. So there are a lot of different ways that people can be brought together without coming in person. And many rare disease patients have challenges traveling, as my son did. So the technology helps a lot.
Thanks. That's very helpful, Dr. Friedman, because we all know how important our support networks are. And it's not just when patients get diagnosed, it's during the whole journey, because it's not going away. It's something that we continue to live with. It's something that Donna and Kim are continuing to live with and to stay vigilant about. So how can healthcare providers better recognize and respond to the psychological impact of a delayed or difficult diagnosis?
I think this is a real systemic issue, at least in the United States. We have to remind ourselves that our healthcare providers, our doctors and nurses and everyone working in the healthcare system, they're all working under the same complicated, difficult conditions that we are when we're trying to use the system. So there are a lot of very good people who are working as doctors and nurses and other professionals in the system, and they're working against the odds just as we patients and families are. So I think there needs to be a systemic look at this. And just as advocacy groups are catching up by recognizing the mental health and emotional experience, the healthcare system, the healthcare training, medical school training, all of what happens in medical systems and hospitals need to allocate resources to pay attention to the psychological and mental health needs of rare disease patients. It's not easy for the providers too. I've come to know many, many doctors and people in the healthcare system because of living in the hospital with my son so much over 26 years. And doctors and nurses are people too, and they're doing the best they can under difficult conditions. And there are some good ones, and there's some not as attentive ones. they're all working under tough conditions. So I go back to find the doctors and nurses and the people in the system who are able and willing to take the time to get to know us and our unique needs. They're there, they're out there. But big picture, I don't know that we in this session can solve the healthcare system part of it, the systemic part of the challenge, because it's significant and it's real.
It is significant, it is real, and we have really raised a lot of those key points today. So thank you. Thank you, Al, Dr. Friedman. It is critical for our healthcare teams to keep in mind that having a rare condition does not just have a physical impact, it has a mental impact, a psychological impact on patients and sometimes on their support team as well. So I'm going to shift it back to Kim and Donna. And what do you wish that healthcare providers understood better about the emotional side of living without clear answers?
One of the things that I really wish healthcare providers understood better about the emotional side of living without clear answers is how easily it can contribute to disease symptoms, especially with rare disease, anything autoimmune or immune mediated. Oftentimes, the stress of not knowing or not having answers can cause us to have flares and symptoms. It can cause us to have increased brain fog, things like that, that just ultimately contributes to us not getting better. So I wish that physicians would look at rare disease or any chronic illness as having both a physical and a mental component, because each of them impacting one another can ultimately lead to delays in treatment or delays in the patient hitting remission. So I think it's important that both of these things are taken into consideration when physicians are looking at chronic illness and rare disease.
Yeah, I 100% echo what Kim said. It really, we become our own worst enemy, when in a sense, our body is fighting ourselves, and then you don't have answers, or, maybe you feel like your symptoms or your concerns are not falling on deaf ears, or maybe sometimes they are falling on deaf ears. And so you start to second guess yourself and what you're feeling. And am I really feeling that? Is it really that big of a deal? Am I making too much out of this? And like Kim said, it can just perpetuate this process of, continuing to kind of enter this flare state of your disease, which is not helpful. So it is really important that doctors realize that when the appointment is over, they are going on to their next appointment, they're going on to their next patient, their next thing, but we're still kind of like maybe don't have the answers that we need to have, or came for, or don't feel validated, and how that can affect us moving forward in a negative way for our disease process.
Yeah, the appointment that you go to doesn't always provide you with all of the answers that you have, and oftentimes I imagine you leave the appointment and you might be riding home, or you might be sitting at home and then thinking, "Oh, I could have asked this question."
Yep.
Right?
Absolutely.
Yeah.
Yeah. So maybe there needs to be some more contact between your appointments, do you think? Would that be helpful to you? And what do you do when you have a question between your appointments and it's not going to be for a few months or something?
A lot of healthcare providers have like patient portals and stuff. And so I'll send my doctor a message on the portal, and they're always very responsive. I mean, it may take a couple of days or a day or two. And if it's really important, if it's something that I really feel like I need to speak to them about it urgently, I'll call the office and I will get through to them. But no, I will always send a message. I'm not somebody who's going to wait, the next 3 months until I see you again and bring it up then, because so much can happen between now and then. I've also started, because of the brain fog and making sure to make the most out of every appointment, making notes ahead of time to be like, don't forget to talk about this, ask about that, so that I remember in the moment in the appointment that this is what I want to bring up. And my doctor's fantastic. I never feel like I'm being rushed in the appointment. I never feel like it's like, okay. And always at the end of the appointment, always they sit back and they say, what questions do you have for me? And so that's super helpful. So I do feel in that sense that the time is being made, the conversations are being had. So I always feel like when I'm in the doctor's office with my specialist that I am being given the time to ask the questions. It's just I prepare for these appointments a little bit differently than I ever used to.
Similarly to Donna, I think we are fortunate to live in a time where we have the technology that our doctors do have these patient portals. And so I'll do the exact same thing as Donna. If I have something that comes up in between my appointments, I'll get on my chart and message my doctor. And fortunately, I'm very fortunate that he is responsive as well. He usually will get back to me within a couple days. And like Donna said, if it's something that I'm really concerned about, I'll call the office. So it's really nice that we have the technology that allows us to do this and allows us to make contact with our physicians in between appointments if something were to come up.
Thank you for sharing that. I don't think a lot of people realize that when they walk out that door or they turn off their computer, if it's a telehealth visit, that they can reach out. You know, different doctors have different means of how to reach out, but it's important for people to know that you may have to ask, what's the best way for me to reach you if something comes up and I have an urgent question, you know? So thank you both for sharing about how important it is if you have something that comes up as a question the moment you leave the doctor's office, which, you know, often happens when you get in the elevator and they're already on to their next patient. It's important to know that you have options. You sometimes need to ask the doctor's office about how to reach out to the doctor between appointments, but usually there is a system in place, whether that's through an online portal or calling the office, or sending an email. But it is a means that patients can reach out to their doctors between appointments. Thank you so much, Kim and Donna, for sharing your story with us today, and you, Dr. Friedman, for sharing about the emotional and psychological impact of rare conditions.
Thank you very much for including me today. I appreciate the attention to not only the medical experience of IgG4 and rare disease patients, but the emotional and mental health experiences of the journey, which is significant. I feel very privileged to be involved in supporting patients with these conditions and very thankful. Although my 26 years with my son, we faced lots of challenges, I'm grateful for what he taught me that I can now pass on to others through my work. So thank you very much for including me today.
We know it's not always easy to talk about your health journey, especially the challenges and the emotional moments along the way. Your honesty and openness are what makes this project so powerful. To those watching from home, you're not alone. The Creaky Joints community is here for you always. We hope this video will resonate with you and impact how you communicate with your doctor. Together, through stories like these, we can move closer to early diagnosis, better care, and greater support for everyone living and affected by IgG4-related disease. This video was made possible with support from Amgen. We're grateful for their partnership in helping us amplify patient voices and strengthen understanding in the healthcare community.